Dologesic-Df is a combination product containing acetaminophen and an antihistamine. Acetaminophen helps reduce fever and mild to moderate pain, such as headache, backache, and muscle strain. The antihistamine in this product can also cause drowsiness, making it suitable as a nighttime sleep aid. It can also help relieve allergy or cold symptoms such as watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. Please note that cough and cold products are not safe or effective for children younger than 6 years old, and long-acting tablets/capsules are not recommended for children younger than 12 years old. It's important to follow dosage directions carefully and not give this product to make a child sleepy. Be sure to ask your doctor or pharmacist for more details on using this product safely, and for other ways to relieve cough and cold symptoms. When taking Dologesic-Df, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. You can take this medication by mouth with or without food, but if you experience stomach upset, you can take it with food or milk. If you are using the liquid form, be sure to measure your prescribed dose carefully using a medication measuring device or spoon. Don't use a household spoon because you may not get the correct dose. If you are taking extended-release capsules, swallow them whole. Do not crush or chew them. Also, do not split extended-release tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. The dosage of Dologesic-Df is based on your medical condition and response to treatment. Pain medications work best when used as the first signs of pain occur. Do not take this product for pain for more than 10 days, adults, or 5 days, children, unless directed by a doctor. Do not take this product for fever for more than 3 days unless directed by your doctor. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Some common side effects of taking Dologesic-Df may include dizziness, drowsiness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication, they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects such as mental/mood changes, like confusion, or trouble urinating. While a severe allergic reaction to this drug is rare, it's important to get medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist for further guidance. Dologesic-Df contains acetaminophen, which can cause serious liver disease if too much is taken. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. People with liver problems and children should take less acetaminophen. It's important to ask your doctor or pharmacist about the safe amount of acetaminophen for you. Do not take Dologesic-Df with any other medication containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen is found in many over-the-counter and prescription medications, so it's important to check the labels on all your medicines and ask your pharmacist if you are unsure. If you take too much acetaminophen, overdose, seek medical help immediately, even if you feel well. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, may harm your liver. It's best to avoid alcohol while taking Dologesic-Df. Before taking Dologesic-Df, it's important to let your doctor or pharmacist know if you are allergic to acetaminophen or antihistamines, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss any medical history, especially if you have breathing problems, glaucoma, heart disease, high blood pressure, liver disease, stomach/intestinal problems, overactive thyroid gland, or urination problems. This medication may cause dizziness, drowsiness, or blurred vision, and drinking alcohol or using marijuana can intensify these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. You should also avoid alcoholic beverages and talk to your doctor if you are using marijuana. For those with specific conditions such as diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires limiting or avoiding certain substances in your diet, caution is advised when using liquid Dologesic-Df products. It's best to consult with your doctor or pharmacist about using this product safely. Before surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of antihistamines, and in young children, this drug may cause agitation and excitement instead of drowsiness. Older adults may also be more sensitive to the side effects of this drug, especially experiencing dizziness, drowsiness, confusion, constipation, or trouble urinating, which can increase the risk of falling. If you are pregnant, it's important to use this medication only when clearly needed and discuss the risks and benefits with your doctor. This drug may also pass into breast milk and could have undesirable effects on a nursing infant, so it's best to consult with your doctor before breastfeeding. It's important to be aware of potential drug interactions with Dologesic-Df, as they can affect how the medication works and increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Dologesic-Df include antihistamines applied to the skin, ketoconazole, and levoketoconazole. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. It's also worth noting that antihistamines are found in many non-prescription products and some combination prescription medications. Always check the labels on your medicines, as they may contain antihistamines or other ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using these products safely. Additionally, Dologesic-Df may interfere with certain medical or lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are using this medication. If you or someone you know has taken too much Dologesic-Df and is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes or skin, dark urine, and seizures. In children, excitement may occur initially, followed by loss of coordination, drowsiness, unconsciousness, and seizures. Remember to always keep medications out of reach of children. Remember, if your doctor has prescribed Dologesic-Df for you, it's important not to share it with others. Make sure to keep all your medical and lab appointments when taking this medication to ensure it is effective for your needs. If you forget to take Dologesic-Df at your regular time, take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. Remember to take Dologesic-Df as directed by your healthcare provider for the best results. It's important to store Dologesic-Df at room temperature, away from light and moisture. Make sure not to freeze the liquid form. Keep all medications out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product according to the instructions from your pharmacist or local waste disposal company. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.